fair enough was to remove the ladder from him so that, they thought they were helping him. Unfortunately, they removed the ladder and then the guy dropped down. One would have expected that the initial response was to grab him, but everybody was afraid. Right? And they allowed him fall down. He hit his head on the ground. He had a serious traumatic brain injury. As I yesterday when I was even he was still alive. However, I'm not God, but his chances of surviving are very slim. Right. Even if he survives, the quality of life thereafter is very, very. So again, you can see I'm sure that one possibly may be underreported. So what I'm trying to bring out is that this number is the number captured by the Lagos State Command Center. There are many more that happen that go underreported and not captured. So we have much more happening. Now let's quickly look at hazards. I'll start with physical hazards. And I'll take a few scenarios that can happen. Of course, we have said the road traffic accidents can happen. They happen every day. In fact, in Lagos, if there's no road traffic accident, there's a problem. You'll be wondering that, when we take statistics in the Lagos State University Teaching Hospital, the commonest cause of why people come to our emergencies is road traffic accident. Either motorbike or RT. That's the reason why. It kills people even more than any other medical condition. So when people say what is the highest cause of morbidity and mortality in this state, it is road traffic accident. I can tell you that for free. Because last week is a referral center and we see a lot of cases. Right? And then, like somebody said again, first responders are also exposed to bombs. Running into a burning scenario, whether a burning vehicle, a burning house, or a fire scenario, right? First responders are always exposed to bombs. Alright, and then, why you are imagining people that are running into a burning building and trying to rescue people, and then the building comes crashing on them, right? So they can also be exposed. That's a scenario. They can also be exposed to, structural collapse injuries. And then, this is also very common. You are trying to rescue people, your focus is on the victim, and you're not looking very carefully. You can also be exposed to sharp objects, piercing the skin, piercing the legs, piercing any of the extremities. Right? And more importantly, disease outbreaks. This is something we also see very frequently. Disease outbreaks. Just yesterday I was reading that Lassa fever seemed for dealing with some of these things. So disease outbreaks also, And then, what are the common ailments and injuries? They have fractures. People can break bones. People can have lacerations. And people can, the first responders can have crushing injuries. Right? And then, you can have different level of burns. Either first degree burns, second degree burns, or third degree burns. And then, physical assault. This is the part, my own opinion, one of the most common form of physical hazard that people are exposed to. And I'll give you two examples. These are two personal examples. A few years ago, we were working on a project in somewhere in Ondo State. And of course, I was a team lead, and my members were the vehicle. And the project got us a driver. And the driver was supposed to make a turn into a junction. He had trafficated normally. An Okada rider was coming with top speed. And the Okada rider hit the vehicle. Of course, the vehicle just had a slight dent, but the man on Okada was flat on the ground. My first instinct as a medical personnel was to come out of the vehicle and attend to him. But that was the biggest mistake I did. Right? Because I didn't understand what was going on. My first instinct was to respond, to see what was happening to the man, ensure he was safe, provide first aid and all that. I did not know that Okada riders are Okada. Of course, when they saw a bike on the ground and a man on the ground, they started parking, all of them. I wasn't aware. When I was trying to ascertain whether the man was alive, trying to get him to speak to me, the next thing I heard was a very, very heavy slap from the back. My glasses flew off. And as I was trying to wonder what was happening and turned back to see who slapped me, another one landed on my face. You know, and I immediately instinct, I just picked the glasses and started running. And they were chasing me. Now, I was not the one that drove the car. I was not the one that was responsible. I was just a passenger in the car attempting to provide the first response. But I was physically assaulted. Right? And I had to run. It was when that happened that the driver of the car now came down from the car and started engaging those Okada riders. What's happening? And they started fighting. But of course, I was just looking for the next safe space to hide my head. Another scenario happened was it last year, 2 years ago? Just when I was young here. You know, somebody was a dispatch rider was riding this Okada and a car hit him. And from where I was standing with a colleague. And you know, since that Ondo incident, I always express caution. But my friend, my colleague, he responded and quickly went to his vehicle, got his keys and started trying to respond to the dispatch rider. And the dispatch rider was an Hausa man. And he wasn't responding initially. So at the end of the day, while my friend was attending to, I was looking from a distance, I didn't move. The dispatch rider woke up and opened the eyes, and the first person he saw was the doctor trying to attend to him. Meanwhile, the person that hit him had gone. He didn't stop. And the guy pulled out the dagger. We don't know where he pulled it out. And when my colleague saw the dagger, of course, he started running. And the guy started chasing on as a job. Eventually, he landed in the gutter with a few cuts and stitches. They had to take him to last week. They had to get stitched. His phone bent into two, broke. Of course, that was consequences of just trying to respond. Yeah, I'm sure that, you know, if you ask him again if he will respond the second time, I'm sure what he responds. But unfortunately, we are first responders. We can't use some of those expressions to say we'll stand aloof. We just have. So physical assault is a very big problem, especially when people don't understand what was going on. Right? In those scenarios, eventually those guys were arrested, they got prosecuted, they apologized. Oh, they didn't know what was happening. They didn't even know what was at fault. And you know, jokingly I tell people that if you are driving and you hit an Okada, just go. Even if you want to hit you, go. Just don't wait. Because nobody wants to hear that don't dare me. Once they see a colleague on the ground, they just want to, you know, physically assault. So physical assault is one. And then one of the dangers when first responders respond to some of these scenarios is that they are responding. And you just see people saying, Mr. A, you are bleeding, or this is happening. And you don't even know. You are too engrossed in the rescue or the response that you don't even know the danger that is happening to you. So they eventually have some form of delayed care, you know, due to the ongoing incident. Or you see somebody in a building, everybody wants everything to calm down. They're not even looking at the dangers that is happening to them themselves. And they are at risk of having multiple traumas. You know, many things can happen at the same time. Now let's also see some biological hazards, you know, that first responders also are exposed to. Of course, somebody said outbreaks the other time. They're exposed to body and body fluids. They're trying to respond or rescue a victim. We don't know what disease condition the victim has before we respond. We don't know what is happening, but we respond. And most of the time when people are victims, they have their body fluids, either blood or any secretion coming out of their bodies, and you have responded, right? So you also, as a first responder, are exposed to some of these body fluids. And then there are contacts with different infectious agents. You can see people, it can be airborne. You are lying down on somebody or bending down to attend to somebody, and the person is breathing back at you. Right? You don't know what the person has, but you are inhaling everything. Right? And then waterborne exposure during outbreaks. You know, people always say that as a first responder, you must also get PPEs and protect yourself. But the truth of the matter is that are they available at those times that you are doing? It's easy when you're in your office or you're somewhere and people say, and then you can quickly get up. But sometimes, out of impulse, people want to respond on time and are not protected. So these are just different forms of contact with infectious agents that people can get exposed to. First responder that can cause. So let me play this video. And I'm using this the terrain by which we have to respond. When I saw the water that day, I was wondering, oh my God, we had to go into this. Right? It was a community that we had to respond to. And this was the entrance to where they were working. Right? We had to get here on canoes, to respond. But you could imagine it was in the thick, you look left and right and everything was so thick. Thick vegetation, but we still have to respond. So you can imagine the biological agents that we were exposed to in this regard. Sorry, I think I move back instead of going forward. Yeah. One very important chemical hazard that people also are exposed to. And of course, this can cause respiratory distress when they're exposed to toxic fumes, clouding their lungs and all that. They have respiratory injuries. And some of these distresses, we have short term, they can just have difficulty in breathing, but some of them leave long-term sequelae, especially when people do it over and over again. And then there are fire service people, right? They go into places where there's thick smoke. And over some time, you now find out that they are coming down with lung diseases over some time as a result of long-term exposure, to some of these fumes, right? And then some of them can have chemical burns, some of them can have chemical poisoning. And the danger in this is that sometimes you don't even know the chemicals you are dealing with, especially when you are talking about spillages from industries. You just tell you that this person was exposed to this, and you're trying to wonder what happened. What did this person get in contact with? And nothing happens. Maybe they just have a cough, and then after getting oxygen, they're fine, and they go home. But some of these things happen in maybe years to come. You just suddenly develop respiratory disease, and then when you're evaluating, you find out that it's because of the work they do, and that's what has caused their illness. So let's look at some environmental hazards and attempt to clear the flows. Right? We try to clear the path or the blockade or reduce the blockade. Right? Then we have heat exposure. Excuse me. This is something that a lot of people don't pay attention to. In the last few weeks, right, a lot of people we have had extremes of heat. Right? Just by standing in the outside space for a few minutes, you see the sun scorching and burning your body. Right? And the people are but first responders work in that scorching heat under pressure. Right? And they're exposed to that sun. Unfortunately, what they will say is that they have to work. But bit by bit, they have a loose fluid from that heat. They lose electrolytes gradually, right, from just standing in the sun. Or even running into fire incidences, the heat of the fire and everything causes them to lose some fluid and electrolytes. And then the person is confused, right? You'll be wondering what's happening to this person. You won't know that it's because of the sun or long exposure to heat that this person has happened to. And then heat exhaustion can proceed to heat stroke, especially when the person starts to lose consciousness. Right? And then you find out that the blood pressure is fine, you check the every parameter, everything is fine. Right? And then you want to make but just by asking the question that what scenario have you been exposed to, and then you find out that the person has been in the sun for a long time, can also cause some of these things. And of course, they can have some dermatological skin. The body, it causes some form of emotional strain. And these are mostly largely unreported. because in this environment, once somebody tells you that the person is depressed, there's a way they stigmatize the person to see that, I was in Yahweh, and that's why a lot of people don't want to come and complain, right? They don't want to speak to anybody, but by seeing some of these conditions every single day, you find out that a lot of people get depressed. It's not easy. I recall that as a young intern, when I finished medical school and I was doing asthmatic, I did asthmatic in UCH. And one of the first units I worked in was the nephrology unit. And you can admit as much as 70 patients, and have 70 patients by the time you are closing at 8 p.m. And when you are getting to work early in the morning, that 76 has reduced to like 20 something. Right? And then I wondered, I would do it every single day because over the night we have a lot of mortality. And then when I was going to choose my specialty later, and then everybody expected me to be in nephrology. Of course, my dad is a nephrologist, so everybody just expected me to fall into his shoes. And I told everybody that no, I can never see this. You come every day and you are losing 40 to 50 patients on a daily basis. That was traumatic. It was emotional. And I felt that I couldn't work in that kind of environment, because most of them come very bad and we are almost helpless. We can't do anything for them. Right? So, exposure to some of these things by first responders also has its toll on people. And a lot of people do not, they try to, not speak about it. And like I said earlier, they'll just be irritable, they'll be cranky, they'll be just, edgy unnecessarily. And you think that they're wicked. No, they're not wicked. It's just the kind of trauma they're exposed to has a toll, that it creates on their mental well-being. And many of them are, later in life are diagnosed with PTSD. They have nightmares, they just shout, nobody is chasing them for art. And then in this environment, again, we have a way of calling it village people. Ya baba, auntie, mommy, no, you see me, one is the work the exposure of things that people have been saying, right? So those traumatic experiences create, a traumatic episode in the mind, and it starts to conjure, dreams and all that. And then a lot of people have anxiety and depression. Again, this is very much underdiagnosed among first responders, and then they have burnout. They are burnt out. Now, these are just some of the things I've said, but these are what you usually see more commonly. If earlier slides I've talked about were things that could happen, physical, biological, environmental hazards, but these are some of the things that we see more frequently. Now, let's look at Lagos people in Nigeria. We have well over 20 million people living in Lagos, and we live in traffic scenarios. People living in informal settlement, that people that even live in their cars. People live on the roads, go to any bridge in Lagos at night, you see people sleeping there. And all that. And we have frequent emergencies from road traffic accidents, fires, flooding. But if you go in there and you don't hear any of these things happening in Lagos, you're always very comfortable to say, well, and all that. And first responders are made to operate in this kind of area.
Why do we doing something else for that patient?
Okay, so as a first responder, what you are trying to do is to minimize risk.
In case of multiple casualties,
yes. What you are trying to do is to minimize risk as much as possible. If you have triage and you see a bleeding patient and you have reduced the bleeding to the maximum, the ideal thing to do is that patient should be transferred to the facility. And then whoever is going to the facility says this person has this care disease. Right? The essence is we are looking at the emergency response on the field. They have a way to control the bleeding. That's why they don't return the field. Now, the thing about it is, a lot of people will say you can forget. A lot of people will also say what happens to the limb when you're putting pressure. Right? And just like even the surgeon, people will say can forget the swab in the body. That is where we always tell people that you need to have every level of alertness on what you pay for the victim. You must always be alert. jury is an artery, no amount of pressure. You understand? Especially when you have to hold it down. Right? If you have to hold it down and you want to transfer that patient to an ambulance, at some point you need to let go of the ambulance. So you can apply pressure and the blood stops. But if you hit a very big artery, that blood is not going to stop. So again, every single trauma is individualized, which is the perfect example. One of the first things you need to apply pressure. But again, that breathing will not stop. If you hit an artery, you will hold the thing with pressure till you bundle you and the victim and the first responder in that position. See the hospital, they will hold it down.
No, we don't do that. Okay.
You understand?
It's not what are the dangers
So again, don't let's think of forgetting to remove money. Don't let's think of forgetting. And that is why, honestly speaking, we should actually have enough first responders. When you are very fast,
not like that. Okay.
yeah, that's what I'm saying. So I said with something so that those people will not start criticizing us. We have to work something, right? So sometimes we have to take legal decisions on the field to protect the victim and to protect ourselves.
Okay, thank you, sir. Thank you, sir.
Excuse sir. Okay, keep your questions. All right, let's him finish the presentation.
Okay, so let's just it down. We'll take all the scenarios once we're done.
Questions and
We'll take all the scenarios once we will. All right, and then of course, once you have secured building, you have attempted putting a line of fluids. The next thing is to transfer the patient. Use universal precautions, right? That is necessary for that patient. Now, for biological hazards, of course, we know that especially when people are exposed to biological agents, you want to wash the wound, as much as you have to use post-exposure prophylaxis immediately and access it to them. So even if first responders are the ones that are in contact with agents, biological agents, with the patient, you need to initiate PB. And these things must be readily available. And that's what I'm saying, is that even in our various offices, we must have space for post-exposure prophylaxis, right? The truth of the matter is that post-exposure prophylaxis is not easy. I've used it before. I need to do quick injury with an HIV patient and I need to do PB. It's not a pleasant drug to use. So please, if we can avoid it, let's avoid it. But we must always have it handy so that it can be used. Yes. So if you are maybe handling sharps, or you're handling body fluids of patients or victims, and you find out that those body fluids come in contact with you. In fact, what I would usually tell first responders again, if you have any wound, you must get it covered before you respond. It is very, very important. You must cover it. Okay. You must cover the wound so that you can minimize the exposure. But again, sometimes you can imagine just walking somewhere and then you step on a needle. You don't know the needle that has been used. Right? It's not antibiotics.
No, I didn't get post-exposure what?
Prophylaxis.
Yeah.
Post-exposure prophylaxis. Yes.
Yeah, so have you mentioned the prophylaxis?
The prophylaxis is you are preventing.
Yes, have you mentioned the ways or you are about to?
We are still in that conversation. This is in response to biological agents, and I mentioned them earlier, right? So the people that brought him to the hospital, of course, you go see everything flowing on their thing is to assume, right? And then when you do a test and you find out that this victim has any of these conditions, the next thing is to initiate post-exposure prophylaxis. Post-exposure prophylaxis for each individual disease that we're looking at. For hepatitis B, for instance, if a patient or a victim has hepatitis B, and the person that is responding gets it, right, gets exposed to the body fluid, right, one of the first things to do in that case is to introduce immunoglobulins if the patient is not already vaccinated. Right? And I would recommend that everybody that is a first responder should be vaccinated for hepatitis B. It is absolutely important. Hepatitis B is more infectious than any infectious agent, even more than HIV. Right? A lot of people, what they usually do is HIV. I always tell people these days that HIV has largely largely be controlled. Because we now have drugs, we have several discordant couples, we have people that, the husband is positive, the wife is negative, the children are negative. Now we won't now have recent advances that once you have drugs that can prevent people from contacting it now, right? Yeah, with the injections now. For hepatitis B, the only thing is that if you are vaccinated, you're protected. If you are not, and the person gets it, there's no cure, there's no drug, there's nothing, right? So this is important that we know this. For HIV as well, there are post-exposure prophylaxis that people have. You want to ask a question? Okay, there are post-exposure prophylaxis that drugs that even if you are exposed to HIV positive blood from a victim or from a responder, there are drugs that you must take within a specific number of hours and you will not be protected as well. Right? So that's also very important. Now, for people that have respiratory conditions, people that have smoke inhalation, people that have had carbon monoxide poisoning, people that have had, an exacerbation of asthma. Because a lot of us responders can have their respiratory issues and maybe an asthma attack, and then they rush into. In fact, my own advice is that as a first responder, once you're doing your baseline evaluation and you're asthmatic, please do not handle other emergencies. Don't handle smoke. It's important because those things trigger, asthma attack. Right? And so what do we need to do? One of the first things is that you must remove the victim from the exposure immediately. The lesser inhalation the person gets, the better for the victim, right? And you must, who knows what a pulse oximeter is, right? It's something that is handy. A lot of people feel that just speaking to somebody makes you weak or makes you think that it's not that. They are trained to give appropriate psychotherapy, right? So please, it's recommended and happy that issues, and then you can seek joint support, right? But don't bottle in. You think that if you speak to them about it, no, we should be able to, speak out and have some people who need to also get that done. Now, for waterborne and environmental infections, and then we should also need to institute infection control measures to ensure that the spread of these infectious diseases are limited, so that it doesn't keep on spreading to people, and like that. Now, these are largely recommendations for, the management, of the clinic. First responder is adequately kitted with the protective equipment, depending on the hazards. For those that need to wear face masks, yes. For those that need to wear helmets, yes. For those that need to wear boots, everybody going into a building and a scholar should not go with our normal shoe. You should go with the boots. Not take the vaccines to protect you. Right? You should take it to protect yourself so that, and then training is also important. And that's why I like what we for us again. And then we should have clear protocols, for every single thing we do, especially even for post-exposure prophylaxis. Everything should be protocol based. Right? Alright, now, of course, I think I've said some of this. Let me just. So, again, let's quickly, just do a case scenario so that we can understand that we are at least getting one or two people today. Imagine, look at the two pictures that I'm trying to put there. The first one on the left is a flood scenario, while the second one on the right is a building collapse, right? So, as a first responder, what are we expected to do in any of these scenarios? What I mean, I'm not talking about the terms of response, I'm talking about what are the hazards that we anticipate responding to these kind of scenarios, and what are we expected to do to mitigate them? So can we have it a contributory class? Can we have it volunteer? I said I painted two scenarios on the board. The first one on the left is a flood situation. Just imagine that there's flood in a part of Lagos, and there are actually that people are trapped, right? You need to go and evacuate them. What are those hazards that you anticipate, and how will you respond to it? Or a building collapse has happened now. people household trapped. What are those things as a first responder? Those hazards that you will anticipate, and what are you expected to do? Is this listen? We'll come to you after. No.
Have you rounded up?
No, not yet.
Okay. Oh, sorry. It's part of the.
Yes, it's part of it.
Good morning, everyone. Honestly, we are my name, the paramedic. Okay, for the flood scenario, you just notice that when you get to the scene, first of all, your safety first. Then you want to make sure that you're on the appropriate PPE, because you don't just go into scene like this without properly being kitted. Then getting to this kind of definitely, it's a flood scenario, so people must have drowned from things like this. So you want to, when they are being brought out from such scenes, because we as paramedics, we don't venture into scenes like this. We wait for our operation teams to bring them out, then we respond. So when we see patients like this, you just know that, okay, this patient is suffering from drowning, and you respond to this patient, check the vitals, initiate your CPR if needed for that kind of patient. Then for the building collapse, for the building collapse, when you get to such thing, your MS is very important for a scene like that. Then patients might come up with fractures, injuries, so you just assess this patient, you triage them. The ones that are very injured, you manage them and move to the nearest facility.
So do you think those in the flood scenario, would you readily have oxygen available?
Yes, definitely. There's oxygen 247.
Okay, thank you very much. All right, Mark, do you want to?
Okay, so I want to talk about the building collapse. The first thing is that there should be crowd control. Because that will prevent effective rescue of those that are trapped. So crowd control, you have to control the crowds. Then the people that are specialized in search and rescue should be in
They also
appropriate.
process.
Yes, they are. They
Okay.
are.
All right.
So they should be in their appropriate PPEs before they even start the venture. Before they even venture this kind of building, that's one. Then they also need to look at likely risk for further collapse, so that they need to test the integrity of the building. Is it safe for us to start this search and
What you
rescue?
said now is one of the first things that is not expected out of said. Before, as a first responder,
Neck fracture, neck injury. So putting collar is the first thing. Then get your vitals of the patient. Then you now transport. You can do triage, okay? And there should be proper communication with nearby hospitals as this has happened. We are bringing victims so that they are ready. It's not when you now take victims, they now know that something has happened, because so immediately if you inform them, there's quick transportation of patients, because they might be men, you don't know how many people are there. So transporting, and there should be collaboration between all the first responders. They should collaborate well so that there will be effective rescue. I want to stop here.
thank you. I think because of our time, I'll stop there. You know, I think we have captured appropriately many of the things I wanted to hear, on what we should do. The only things I will emphasize, very, very much is please, as much as possible, first responders need to be properly kitted, right? And I'm happy also here. We also need a proper incident control management system, right? Something that tells first responders where they can get immediate care from the field when they're responding, right? Wherever, which hospital is closer. So I'm hoping that because they will get to a point where we are able to have a dashboard that shows us where space is available. A dashboard, to show where space is available. Because the truth of the matter is that leaving the field, getting to the facility, and they are hearing that there's no space.
Oh, yeah.
There's no
Okay,
space.
they are working on. You mean bed space?
Yeah, where the
We've
space.
been working on it for years, but they are still working on it.
Yes.
And I hope that something will.
Yes, that's what that we can get that done. All right. So many of these recommendations I've said in the course of my lecture, and I'll conclude by saying that our first responders are very critical to everybody's safety. You know, the different, many incidences of people that should have survived death that they get, right? And these are offered by first responders. You know, so thank you very much for your time. Thank you very much.
We appreciate that you shared from your wealth of knowledge here. So right now it's time for questions and answers. So we'll take questions and answers by a show of hands. So we can see how many numbers you have.
So sorry, because of the checkout, we need to check out for those of you that have not. Let's give you, when we come back, I think we'll continue. Let's quickly go and check out and come back. We're giving you 10 minutes. It doesn't take so much time. 10 minutes. So when you come back, you'll be able to do this. How many people are going to?
I have made a lot. I hope you have all day. Alright, that's what thank you. So you will still wait till the PS comes so that we can take a picture, a good picture together. Okay? Can we have a second?
We are about to have the second presentation for today on leveraging innovation, technology, and data for excellence in emergency medical support. And that will be presented by Dr. Raphael. It is in health, data governance, interoperability, and digital transformation, including leadership. Recognized among the top 50 global thought leaders in healthcare from 2024 to 2025, it drives innovative solutions and advocates for secure, data-driven, and equitable healthcare system. Please give it up for Dr. Raphael.
Thank you very much. To really, work on this. Yeah. The presentation version is on leveraging innovation technology. It's what we will be able to present to you, but let us just look at it. What is the primary goal of emergency medical service, EMS? Provide long-term treatment. B, offer hospital-based care only. C, deliver immediate care and transport during emergency and give the case of services. C, is that a final answer? Wow, please put your hands together. A core component of EMS. A, ambulance services. B, emergency communication system. C, pre-operational. I'm hearing so many echoes. D. Wow, put your hands together. We have a real challenge affecting EMS efficiency in Lagos State. All right, great. Thanks so much. We have great people in the house. Fourth question: which technology is most useful for tracking ambulance location in real time? A, blockchain. B, GIS. C. What? GIS. That is B. Okay, let's check it out. Correct. Please encourage yourself now. How many brilliant people in the house is not? So the last question we'll be having here. Question 5. Why is data important in EMS? Wow. Thank you so much. At least you really made my day today. So, responders without integrating technology into what we are doing. But most importantly, again, there are other things that we need to look into. But the key part of it is the data. Data is very essential to an extent that without data, there is no how every one of us seated in this room can actually be relevant in our field of studies, in our field of practice. So it is very important that we know how data should be handled. I always tell people that come to me that data is equal to life. When you take data out of any system, there is no how such system can improve. Look at every organization that are thriving, that are moving forward today, and those ones that are stagnant. The difference is data. One is applying that data in a more relevant way than the other. And this is the reason why it is very important for every one of us to embrace how our data is going to be used in order to promote our activities. So, I'm going to start by way of introduction. Dr. Adedayo, while he was giving his presentation, actually said part of what I have on the slide. So I'm not going to repeat what he has said again. If I have the opportunity in this state, those of you that are first responders in Lagos State should have special salary, to move on. The reason why I said this is not only because what Dr. Adedayo came here to talk about. Seen in different places that you actually go all out to risk your lives in order to save other people's lives, which means that you need to be much more compensated in order for you to be able to discharge your duty effectively. So, and I believe that by the time nothing is going to be done. So, I want to, urge everyone to know that the work we are doing is not just ordinary work, it's a lifesaver. Yes, God is the number one lifesaver, but that responsibility has been committed into your hands to do what? To save those who are in danger. Those who need, there is no day, just like he said, there is no day in Lagos that you will not hear that there's no, a day goes without accidents. There's always been different accidents, from one place to the other. Secondly, cardiac emergencies. This will definitely come up because of so many things that we have been exposed to, health-wise and other environmental factors. The third one is maternal emergency, which is another aspect that we need to really look into very well. Like I said, I'm not going to, get too fast. So, what is emergency medical support? What is emergency medical support here now? Now, if you look at what we have up here, the pre-hospital care, emergency communication, trauma, stabilization, rapid response to care facility, this summarizes what EMS is all about. We are doing in Lagos State. Now, EMS is simply a coordinated system that provides immediate medical care to people experiencing sudden illness or injury, especially before they reach the hospital. I don't want to dwell much there because Dr. Adedayo have actually, said something about that. Now, I love figures, I love data, and this is the only tool that the policymakers are using to take decision. And if you look at what we have up here, the current EMS reality in Lagos State, that is the key statistic of 44,152 cases. Please, can you put your hands together for yourself? Because who are the people doing it? It is you who have been doing it. Now, the next one here is talking about the response rate. The response rate, that when anything happens, when they call on you, what are the response rate? We have about 97.5% of your responses. It means that when we're talking about those that are making Lagos to grow, your name should be written on gold. So this is very, very important. Now, patients treated, about 36,919, between 2021 to 2025. I don't know if that statistics, that's, stuff has changed now, but, the enews.com.ng as of June 13, 2025, gives this report, right? Now, Ambulance units. We have about 25 ambulance units, in Lagos State. Am I right? And it is sufficient enough, right?
No.
No, I'm not. Let them respond. They are the one in the field, so they should just let us know. It's sufficient, right? Okay. So meaning that we need more. Now, if you look at the median response time, then that is another area that really tricked me. We are still moving forward. It tricked me. The response time. The research showed, not only to me, to the entire world, that when they call on these first responders, approximately 20 minutes, you are always there. To do what? To offer your quality services in order to save life. Please put your hands together. I'm here to encourage you that you may not know the extent of what you have been doing, but a lot of people in the world are actually getting, so high response rates, but we have limited infrastructure. What is that infrastructure we are limited with, please? Can somebody tell us? Ambulance units. What? Staff. Please talk to me. Time. Staff strength. So thank you very much. Now, then the response time is still affected by the traffic and logistics. We all know that. These are part of the bottleneck that we're having. And of course, if it is possible for Lagos to increase its land mass, I think it will be better because the state is already congested. And a lot of people, so many things happen that we don't even know. It is only the one that you have responded to that has been that we have recorded up here. Now, emergency boarding in Lagos. There are so many boardings that we have in Lagos State, and of course, I got this one from Springer Link, November 17, 2023, right? And if you look at the metric, we have victims analyzed in study. The victim analyzed in study, we have the value there, 1,220 plus of victims. Then, secondly, we have male victims, 71.3%, which means that those people that are greatly involved in this emergency we're talking about are what? Are more male. Why is it so? Please, let's make it interactive. I think Dr. Adedayo, started that, so I want to follow suit. What is the cause? We have 71.3% of male victims. Let us leave it to them, please. What's the reason, please? Come on, please. Let's be friends now. She can't really put my eyes now, right? What's it? A lot of risk. Thank you very much. A lot of risk. And what other factor, please? Breadwinner, yes, that's part of the risk. Sorry, I didn't get you. Maybe
a lot of times, male victims, okay, you're talking about male victims, a lot of times one male falls within that 71% because they seldom seek medical attention. A lot of times, men seldom seek.
Can you hear me? Can you hear that? Because you feel you are clean tongued, right? So you cannot be sick. Wow, thank you very much. Any other factor, please? Doctor said something here, but I just want us to think, and women. Why is it so? They're taking a lot of risks. Sometimes they don't seek medical attention. What other things? They are on drugs. Alcohol. Beautiful. Now, to add to what I just said, right? you agree with me that when it comes to transport system in Lagos State, we have more number of men than women, right? And most of our public transporters in Lagos State, they have these that without them shacking up, there is no how they can perform effectively. So you will always see in the pigeon, in every pigeon hole of every danfo of Marwa, Kekena, Korope, LT, and what have you. At the dashboard, you will always see.
So the pre-test, have we done it?
Yes, we have done it. We got it all. Data interception. Now we are making use of electronics. And there are some smart people outside there. They don't even need to come into your office. For example, if you have a tablet that you are using, it is very important you know how to use it well. There is a device that can actually steal data from your device. It's just as small as the phone that you are using. And once that person, operates it and puts it in the pocket, the person just needs to be about 10 to 15 meters away from you. All the data you have on your laptop, the one you have on your iPad or whatever, that data is going to be, cloned from your system. The data is still going to remain on your system, but it's going to be cloned from your system. So that is why it's very important we have this knowledge when it comes to using of technology. Now, digital health integration. For integration, I think we have talked about this EMR, HIS, Health Information Exchange. And also the benefit is going to create a faster clinical decision, reduce duplication, and improve patient outcome. Now, I'm rounding up very soon. Now, the impact of technology and data on emergency outcomes. This is comparative impact table. We have the parameter, traditional EMS and digital EMS. Traditional EMS is that way that we have been practicing before. And the digital one is the one that is going to enhance our job. So, for parameters that we have response time, data availability, decision making, patient survival, and coordination. You can see the difference between traditional and digital EMS, which is the best to use when we are, operating. Now, I have this table. I made this little research. Like I said, I just like the data, right? And we have Lagos versus 5 Nigerian states. And this is the area I feel so happy with Lagos State. Even though some people may say that things are not working, but the fact remains that Lagos State can never be compared to any state in Nigeria. So, Lagos State is called a country within a country. Sometimes there are some things we have in Lagos State that even Nigeria, the Federal Capital Territory, does not have. And the record is there. If you look at this here, we have the parameters, right? Lagos State and 5 other states. Federal Capital Territory, Oyo State, Delta State, Rivers State, and Kano State. And all these credit goes to you. EMS structure in Lagos State, it is fully organized and statewide EMS, right? If you look at Federal Capital Territory, it is semi-structured. That means Lagos State is even higher. Who is making this to be higher? It is you. You are the first responders. You are the one working in this 45 minutes and above, right? Before they can get to where the victims are. So please put your hands together for yourself. This is a great job. Now, let me put quickly come down to the technology use. Of course, when it comes to technology, Lagos State, we are still using moderate GIS and MRUs. Imagine, they are still emerging. Federal Capital Territory low, other states low, and Kano minimal. So Lagos State is working. These are part of the statistics you can present to the government that this thing is already working. That can make you to tell the government that you need more of this. But when Yoruba has an adage, permit me, Yoruba will say, when you tell the government that you have done a great job, and these are the evidences, the government will be moved enough to do what? To do more. And that is just it. And here, I did another research. I now compare Lagos State with 5 different countries in Africa. I did say that I make a comparison of of Nigeria and other countries. Lagos State as a state and other 5 countries in Africa. Look at the result up there. The EMS model, that is a parameter. Lagos State is a state-based. Lagos State is the one that is funding. That one is being funded by National Ambulance Services, right? The Senegal, urban-based EMS, Côte d'Ivoire, mixed system, Sierra Leone, they are depending on NGOs before they can carry out their emergency medical support. Honorable Commissioner for Health, Professor Akin Abayomi, was I think it was in the last yesterday. I'm sure he would have mentioned LASHIP. LASHIP is a project that has never been done in any country in Africa, and only Lagos State that is coming up that is initiating it. So now we have that, and Ghana moderate, other countries low. It's only Kenya. So if there's any country that Lagos State needs to compete with, it's only Kenya. I'm talking of Lagos State. I'm not talking of Nigeria. Meaning that Lagos State has, a lot of, plan in place that some few countries there does not have. So if Lagos State assume the position of what? Of becoming a country, it is standard enough to become it. And talking about this aspect of EMS, this has been made happen because of every one of us seated in this room. So I'll be rounding up. These are the recommendations I just put in place concerning, emergency. Together, please. So there's a need to do what? To expand ambulance fleet and smart deployment. Number 2, strengthen data integration. That one can be done through LASHIP, whereby any
especially on behalf of our own medical director of first responder medical clinic in Lagos State, and who is the great pioneer of these laudable events. We like to show our sincere appreciation to our presenter, who has presented a very insightful and engaging presentation. Thank you so much, sir.
much. Question 2. What is the role of data integration in emergency medical support systems? A. To duplicate patient records. B. To isolate healthcare systems. To enable seamless information. Thank you very much. Number 3. Which of the following best describe the importance of data privacy in EMS? You have access to it already, I know. B. Thank you very much. Thank you. Then, What is the key benefit of using predictive analytics in EMS? Okay. Correct. Thank you. Wow. I think your result at the end of this event is going to be A++. Last question here. Which combination best drives excellence in modern EMS? Paper, record, and mass, life, innovation. Thank you very much.
A round of applause once again for Dr. Rakola. So I hope we are still open to learn, because I'm about to bring on our third presenter for today, and he's here with a lot of knowledge to share.
I want us to get up. Let's give a locomotive clap for the organizer of this program. A locomotive clap. A locomotive clap. A locomotive clap. A locomotive clap. Thank you so much. Let's say big thank you so much, man. We appreciate you. You know, this is the first of its kind in Lagos State. You know, somebody looking out for the welfare of the first responder. You think it's easy? It's not easy. We've been working for years.
Yes, so
20 years, 25 years to be in this service. But, you know, no, they look at first was actually having it out like this. It's not, this is the first of its kind. So, just yesterday, the Lagos State First Responder Health Professional Conference started. The participants arrived, they said arrived around 7 a.m., around 8:40 a.m. with the MC calling on the first person of the day. We have the opening prayer by a volunteer that please praise the everything to God's hand of what we were doing yesterday. The first facilitator was Dr. Babajide Arulogun. He's a consultant and director, GRI School of Leadership. The topic he took us through yesterday was the first responder, the second victim, recording the health of those who serve Lagos State. He really dealt with this topic because he was looking out for the health of first responders. He took us through the recording where he stated that every work carried out in Lagos State has its hazard. Some are contingent and obvious, while some are continuous and hidden. And that's what we do. Some of the activity we do is very open, people will see us, but some are hidden that we do behind the door, and we're still moving ahead. The session objective was to identify hazard, ask questions, and recognize the 3 hidden hazards that are really affecting the first responders. We went ahead to give us the first activity for the day, where he asked us to write down first 3 major injuries. He put up, there was a clip, a picture of the platform where we have some a bomb vehicle, LASMA official, some fire service attending to a bomb vehicle, and he gave us this activity that we should write down the first 3 physical injury we will expect from those people attend to that call. That's the first activity given to us, and participants knew who we are, what we do every day, and how we do it. We gave the response out that's going to expect burns, inhalation injury, the smoke inhalation. Another aspect can occur because while the last time people were attending to things, another vehicle can just run over them. So we were able to give out different answers to them. Fracture can occur, some bruises can occur at the same time. He went ahead to discuss with us that your best diagnostic tool is not the stethoscope you're using every day, but it's the question you're going to ask yourself after the work of the day. How have I done? What have I done? How did I do it? Did I do it well? Did I take care of that patient? Was the patient okay? Did I give the best care to the patient? Those are the questions that we're able to ask. Then we went ahead to discuss with us the injury versus illness, the constant reality that at times we don't really take note of. there are three parameters to it: the aspect of it, the injury, and the illness. The aspect, the nature of injury is always sudden and traumatic, while illness can be gradual, systematic. The onset of it can be on injury, it's immediate. Most of the time, very immediate. It's happened suddenly. While on illness, it's delayed. It's built up over time. A lot of things happen that really cause a lot of damage to some of the organs in our system. So another one is visibility. It's up actually. You see, as they're victim, you see that most of the things that happen to them is very visible. You will see them either fracture femur or bruises or laceration or something. You just notice that something happened to them. But when you're talking about someone that is sick, it's actually sometimes not too visible. Somebody with cancer, someone with some chronic disease, some liver disease, so it's not quite obvious outside there. So some of the examples are broken bones, the fractures, the CA that can happen. So he went further ahead to tell us that he wants to really thank us. We are heroes. Are you not heroes? We are heroes of first responders, and he really thank us. He admonished us to be a detective. Look out for what you're doing and detect it early enough. Be a partner in prevention. Don't cause more danger to the patient. You educate them and also try as much as possible to take care of yourself. Look out for yourself and be an advocate of specialized care. Push for your agency to be up there, and a lot of screening can be done to help yourself. Be the link between the longevity, your own longevity, be the link between it, the patient longevity, and your own. Because your safety first help that patient to move ahead. So he went ahead now to give us a lasting legacy. That what we are doing here is a lasting legacy that will go far into a long time. And what we are building is more than a clinic. Is that not true? What we have here, what we are being taught today, is more than a clinic. Because we are building a resilient emergency health support system. And in Lagos State, the first responders are the priority in all care. Everything we do, we are the first priority. We need to look out for ourselves. We need to look out for our safety. And we need to look out for the best care you can give to yourself. Because if you're not safe, you can't take care of that patient. If you're not safe, you can't give the best of care. So let's give it again to Dr. Shokubi for this wonderful time, for this wonderful lecture. Thank you.
So Mr. Oladamola,
appreciation is different. And who? I want us to really acknowledge the good work Dr. Shokunmi has been doing. And not just now. Let me give you a few background story. Right. When she adopted me into the ministry, that was about 2018. I was still in school then. But she's someone that, she's like an institution. You know, some people, you have some directors, they just do one-off program, and that was it. But when it comes to this life support training, I've been in this industry for almost 10 years now. She has been consistent. Meaning that, not under her watch, she's not that kind of director or commissioner that she'll be having a meeting and someone will drop, and nobody around everybody will feel confused. So let's just appreciate that. Thank you, ma'am. For being consistent. Like I said, this is almost 8 engagement. She can ministry, she still continue to the same level. So, ma'am, thank you very much for always being consistent. Thank you. And then, lastly, let's appreciate ourselves. Celebrate ourselves. Right. Just think about your loved one. Think about your mother. Think about your father, your children, your close friend. Imagine them just, drop, collapse right now in front of you. What do? And this is not a question of God forbid. It is a reality. Now we've talked about the care we give to patients. And I don't want to go over that again. Now, when we're talking about pre-hospital management, sometimes we are the system. And then we're talking about chain of survival. Chain of survival start with who? With you. Now, imagine them, they are still in front of you. You call for help. The ETA of Los Angeles ambulance is 40 minutes before they get to your location. What do we do? One house says, Mom, thank you. Right. This class is polar, especially workplace emergency. Right. So it's okay we are looking for other people. Do you know a lot of doctors, nurses die? Some of them after duty, they just drop. So in as much as we are, want to give excellent care to others. Now, how are we also safety in our own environment? When you are the gap between to bring someone back to life.
You can encourage the child to cough out. Then if it's not possible, if the child is not able to cough that substance out, you want to give the child a back slap and 2 back slap and to help assist the child bring out that object. And in doing that, the child is not standing straight while you are hitting the back. Like, use the heels of your palm to do that. So you're leaning the child like slightly down, and you're using the heel of your palm to give that child a back slap, like in, up, inward and upward movement. So if it doesn't work, you do your Emish maneuver. Please, let's pay attention. So you do your Emish maneuver, which involves you going behind the child, then, okay, going behind the child. Okay, so how do you do like this?
Hold on, 1 hour. This is not a 10-year-old to begin with. So this can be used as an it was very well clear scenario. And all I need you to do is, I don't need you to walk me through it. Just tell me. Like now, as a paramedic, you're being called upon. Let's say somewhere in church or in crèche or school. Right. And then, we have a situation here. Now, how do you respond to that situation?
Okay.
Talk it, don't ask it.
Okay. Like I said earlier, first of all, when you arrive to such scenarios, you check the child, assist the child to cough it out. If the substance or the object is visible, you assist the child to cough out, encourage the child to cough it out. If the child is not able to, you go behind the child, give the child a 2 back slap, inward, upward movement to help bring out that object. Then if it's not coming out, you want to do your Emish maneuver. Go behind the child, then create a space in between the child's leg. Pull one leg forward, in between the child's leg. Go around the child. Use one of your non-dominant hands. Wrap around the child's abdomen. Then you want to place your tongue at the belly button, the navel of the child. Something like this. Then you use your other hand around, hold the child firmly. Then you do an inward and upward movement, which will help bring out that object to that child.
All right, thank you for that. Now, another thing, the assessment I was expecting you to practice is that, everything we are learning so far here, all of these skills you can use, you can apply for yourself. Tell me, if you're joking, can you relieve yourself? If you have cardiac arrest, can you relieve yourself? Can you compress yourself? I think the only thing you can do for yourself is recognizing stroke sign and then heart attack, and then from there, call someone to take you to what? Hospital. And if you have those symptoms, you do not drive. Are we together? When you suspect heart attack, stroke, do not do what? Drive yourself. If there's no one around, call Uber. Don't drive. And once you know that, please go to the right hospital. Which are you ready? Are we together? If you are being called upon that, oh, someone just had a snake bite, how do you respond to it? Okay, ma'am.
So for snake bites, it's actually very, very complex. But the best thing to do is just to take the person to the nearest hospital. And there's now an advocate against tying tourniquet. You should not. So, but another issue now is when we are taking this patient to, do they have the anti-snake venom? Because that is the only solution. Aside from the other basic things you do, like, okay, let's check the hemodynamics. But the way out of that, of complications from snake bites is antivenom. Well, by the time they get to the hospital, and hopefully that is a standard hospital, there are things they can do while they are waiting for the antivenom, because ICU is the next point of call for such patients because of the adverse effects. And it's also said that it depends on the kind of snake, and you should bring the snake along with the patients. How possible is that? Thank you.
Let me have something. When it comes to snake, of the Honorable Commissioner for Special Duties and Intergovernmental Relations, the chief host of this very ironic initiative. Can we please put our hands together for him? In the last few months, the first respondents clinic has taken a new shape and a new dimension. And I can tell you boldly and categorically that we have been able to achieve this due to his unwavering, continuous support, encouragement, inspiration. We are here because he's supporting us. Can we give him a big. And it started before they entered Ministry of Special Duties. Continue to clap. Before they met the Honorable Commissioner, before they entered his office, I knew that I was going to do it. Don't sit down, we communicate. Another round of applause. Can you please sit down? You will permit us to break a bit. How many minutes?
Yesterday, we've personally, I know that I have gained more than how I came here. I'm a better person than what I was 2 days ago, because I have some past knowledge on basic life support. And from the first lecturer to the present lecturer that is ongoing now, I have actually achieved a lot. And I know that from here, if I should go back to my agency that sent me here, and I give them a feedback, I know there will be room for improvement, in the sense that based on the last lecturer before him, he made us understand that there is room for innovation and technology, and which will help us make us work smartly, because even gone are those days where manpower, or let's say hard work pays, but now smart work is what pays more, because technology is the order of the day. So there is need for us to synergize between technology and our medical system. So these are one of the take back that I'm going to take back to my agency, and I believe it's the help, because I know one way or the other they will still come back to the Honorable Commissioner, because you are the one that is in charge of the ministry which we are under, and I know that with the support you've shown us so far, I know we are going to get more support to improve our medical health system. Thank you, sir.
Your name and your facility.
Apologies, my name is Balu Muidin Abayomi. Public Safety Corps.
Thank you very much.
I'm from Lagos State Fire and Rescue Service. I'm so happy to be here. I've learned a lot, at least about the diseases and how to manage our staffs. Now we know the first aid, the response on how to take care of them. And I'm also going home with, I am not a support staff, but I am a force behind the force. That means I'm going back to give them the feedback of what I've learned here. Thank you.
Thank you so much.
Of this program, especially the Honorable Commissioner. My name is Mafolayomi Grojaye. I'm a pharmacist and I'm currently serving at the Safety Arena Medical Clinic. Yesterday, when the conference started, all the speakers that spoke really touched what they were supposed to. But I remember that Dr. Abiri said something about mental health. She said, you cannot pour from an empty cup. You have to take care of yourself. And that statement has resonated with me because I know that as first responders, as healthcare professionals, you don't even care about yourself a lot. You don't even think about yourself a lot. My patient, until you become the patient. And one thing this conference has taught me is that you should prioritize your health, and I'm sure it has taught all of us that. So I'd like to specially thank the organizers one more time because this program was needed for me, and I'm sure it was needed for us all. Aside the time, it has been a really good time to network and meet people from other agencies and socialize as well. So it's just been all encompassing. Thank you very much.
Experience, and I appreciate you for the support you have been giving to our director so far. It has really, we are really feeling in every moment, every day in our facility, we are really feeling that support from our mama, Dr. Mrs. Shokunbi. I want to appreciate you, Honorable Commissioner, for all this work. And this program especially, we believe, even when Dr. Shokunbi, if you didn't give that big support, you can as well say, Dr. Shokunbi, this is not the time for this now. But it's really your support that brings this thing up. So we are saying thank you, sir. My name is Nurse Ibitoye I'm a staff nurse in Safety Arena Clinic. Thank you so much, sir. We appreciate it.
So we would like our speakers to also share what their experience has been as regards inviting them to this graceful occasion. And
Commander, continue.
Fire is only one. Fire will join us.
It's just one.
So,
I guess I'm representative of task force. Please give me a document.
Okay. respondents.
Every life matters.
First respondent.
Every life matters.
First respondent.
Every life matters.
Good.
First responder.
So can we do
Every life matters.
First responder.
Every life matters.
First responder.
Every life matters.
So we're going to do it one more time. Get the video right. Both you and both you. Okay. So somebody will say it again.
First responder.
Wait. What do you say? Alright, so let's be smart. Let's put energy into it. Okay. 1, 2, go.
First responder.
Every life matters.
Responder.
Every life matters.
Responder.
Every life matters.
All of you know. I said so. I said something. Next time on my platform. Go to the back. Okay, yeah. Thank you,
First responder.
Every life matters.
First responder.
Every life matters.
First responder.
Every life matters.
Are you okay? Can we go?
It's the grace to be a partaker of this opportunity. And not only be a partaker, for him to have seen everyone pass through. A journey of 2 days is not a joke. And we have no cause to have any reasons to say that there is a casualties or any untold event has ever happened in the course of the conference. It calls for glorifying his name. And having said that, I think I should on these notes. I don't know which word to use. And because of the fact that somebody whom God has created specially, having a good thought to build life. You cannot measure or quantify the privilege and the opportunity you have had having this program. For returning all of this back to somebody who has sat down, conceptualize it, and having bring it to fruition. You know, as at the time when she came into the ministry, it started within a short space of time. It started coming up with a lot of program, and I was now energizing now. People start giving
some kind of interpretations, but that never hold her back in doing what she knows best to do. And that's the result of what we are seeing today. And it's not any other person. And the amiable personality, a jewel of inestimable value. So if you are beauty outside, you are not beauty inside. You have no space. Everything around her is all beautiful. Now, why am I saying so? If there's anybody who have all in his or her life is only thinking about his fellow human being, that's where the beauty lies. It's not about physical beauty, because all of you can misinterpret, even though she's beauty in and outside, but that's the ingredients of life. Madam, God is a rewarder of mankind. And I know, in as much as you are receiving your reward on earth, heaven is equally awaiting you. Let me so yes, in all that we do is for us to, people who have sold into your life. You can't imagine having to go through a lot of experiences and to come and share a series of case studies. All what they have taught you is not about going to textbook or reading and come and narrate it to you. You have gone through practical life experience, and they have come forward to come and show you different case studies that will help you to be a better human being and to equally build your capacity. And on that note, for all our facilitators, I cannot start picking your names, but I think you will stand up. Can you just applaud them? Thank you so much. I so much delighted and happy to ensure that these days come to fruition. I am trying to pick on your slogan so that but I don't want to start. Every life matters. Every life matters. Every life matters. First respondent. I didn't see that agility. I meant to display this. Maybe because you are in a medical session. But what I want to bring out is this. At least I've spent over 3 years as a commissioner in charge of Ministry of Special Duties and Governmental Relations. And on several occasions I've attended an emergency scene, having to see my guys, my respondents, the nationals, and I can see at every event it's like that energy that comes from naturally. If you see Lasema on the field and with their team, you see that natural. When you see fire service and you see that agility, and that's what makes the life of first responders so unique and so beautiful. And that brought about, why are we thinking in this direction? When I came in, I have a series of informations that comes on board, that after respondent leaves service, their life never be the same again. It's not because of anything, it's because they never pay attention to their health or well-being while they are in service. And that became a challenge. And I think that's what resonates the reasons why we are at this point. And thank God that a helper has been able to help me and help my colleague for us to see the first inaugural of this first restaurant. What I want to say to you is that I want you to take your health very seriously. Even though this does an infractions of the numbers of those people, we have thousands of first responders under my ministry. But because you are representatives, you are heads in charge. The education must go down the line from you. Since you have seen it the way it has been, the education must go down from you. Actually, I'm supposed to be in another meeting, and that's why they have been calling me. So, in as much as I don't want to labor us with a little race, I want to thank God for your life. I want to thank God for having spent this time, and I want you to take majority of these things. It's not only for you to just believe that it ends here. You do review, you do relearn, you do retraining, you read, you at least try to bring them back to your memory so that it will always help you. You can equally be training the trainers. Because I could see that majority of you that are here as a large numbers, and I will make sure I inform the agency here. For some of you that are here, you must go back and begin to have that sessions of on that to educate other people on those things you have learned today. Because I know you have a lot with you. If you have timber caliber of doctors who have their whole experience and they have given you all what it requires for you, I think you should share. On this note, I want to thank you. And that, it's okay. Thank you.
So let me check this muscle. Mr. Jones, right? So I'm checking for the pulse, I'm looking for the chest, for visible chest rise. For how long? Not more than 5 seconds. Not less than 5 seconds. Not more than 10 seconds. Can we echo something together? Golden seconds, 10 seconds. Golden seconds, 10 seconds. Golden seconds, 10 seconds. Golden seconds, 10 seconds. Now, the golden seconds starts when the scene is safe for me. You can't use because of golden seconds and go and enter the scene that you become a victim for. Very good. So let me check. I'm picking 7 seconds. In between what? 5 and 10 seconds. So I'm perfecting for the carotid pulse, and at the same time, I'm looking at the chest for visible chest rise. Not more than 10 seconds. Not less than what? 5 seconds. So let me check Mr. Jones' pulse and breathing. There is no pulse, and this man is not breathing. What should I do immediately? I want to start helping the heart to pump. Now, if there is no pulse and he's not breathing, it means that the heart has stopped. In hospital, it should be easier for, if people are trained, it should be easier for them to recognize. Because inside the hospital, there are so many gadgets, especially in critical care, that even make people to miss recognition on time. Now, the simple thing I did, I just check for pulse. There is no pulse, and there is no rise and fall of the chest. It means that what? The heart has stopped. So because the heart has stopped, how do I help the heart to pump? What does the heart do? The heart pumps blood. And because it has stopped, the protocol, international standard, American Association says that you should start compression within 10 seconds. You recognize that the heart has what? Stopped. Now, what makes you stand out as a first responder? Your high quality CPR skills. Not just holding mannequin, taking a picture with it. What makes you stand out is how you compress. What are those components of high quality compression? So that's what I want to do now. Can we all touch the heel of our palm, please? The heel of the palm. Good. The heel of one palm and center of the chest. Can I have the mannequins in different things? Because people are tired. Please, I need help. Help! Please, I need help.
Deeper. You're not compressing like that. Go deep. Go deep in love. One, go deep in love. Deeper. More deeper.